Hello and welcome to today's webinar hosted by the Dr. Susan Love Foundation for Breast Cancer Research. My name is Crystal Hertz and I'm the research manager here at the foundation. Today, joining Dr. Love and myself is our special guest, Dr. Andrew Chan of Massachusetts General Hospital. At Massachusetts General, Dr. Chan serves as the chief of the Clinical and Translational Epidemiology Unit. And today he will be telling us about the COVID Symptom Tracker. So without further ado, the stage is yours, Dr. Chan.
Thank you very much to Dr. Susan Love and her foundation for giving us this opportunity to work with the Army of Women on our work with the COVID Symptom Tracker. This is really designed as a call to action for all of the folks listening on this webinar and also for your friends and family to join in our citizen science effort to combat this COVID-19 crisis. I think just to before I begin with my presentation, I do want to provide you some context about my own personal background and my own interest in doing this work. I am a physician and my area of focus is in cancer prevention. I work with many patients at the MGH Cancer Center who are either dealing with cancer or family members that are living with cancer, and work to try to develop opportunities for prevention of their disease, and also to help to ensure that they lead a healthy lifestyle. What we've been focused on for many years is really trying to understand the role of things like diet and lifestyle in the prevention of cancer, which led to a collaboration between my group at Mass General and also a group in the UK to do a dietary intervention study using mobile technology, or specifically an app. When the COVID crisis came about, I think we all looked at each other and realized that we needed to do something to respond. In particular, we realized that for patients that are either living with cancer or are family members of people living with cancer, there really was a need for us to be able to reach out to people, to really let them know that we wanted to understand the circumstances behind what they were going through, and also to collect data on something that we really knew very little about. So we really reconfigured our work in research and our mobile application for dietary studies into this COVID Symptom Tracker app. And it's really become something of a personal calling for all of us who do this work to really try to use this as an effort to get around our deficit in knowledge about COVID-19, in particular, how it affects people with cancer. So let me advance the slide and show you what we know about COVID-19 so far. And I think many of you already are familiar with this. It is a virus which causes a very severe set of respiratory symptoms in many patients. And the symptoms can vary from fever, cough, shortness of breath, to loss of taste or smell, or even gastrointestinal symptoms like diarrhea. And what's become clear is that there is a wide spectrum of symptoms and also a wide spectrum of severity of illness, with some individuals coming down with COVID-19 with relatively mild symptoms to other folks coming down with the condition with very severe symptoms to the point where they need to be hospitalized. And of course, we've all heard the terrible stories of people getting so sick that they end up in the intensive care unit, and some of these patients ultimately die. And that's because some of these patients develop what's known as an acute respiratory distress syndrome related to the infection. The scary thing is that we know very little about COVID-19. First of all, we know something about the symptoms, but our understanding is very incomplete. And we also don't know so much what is it that are risk factors for why someone might develop a very mild case versus someone who develops a very severe case that ultimately could lead to death. It's been clear that the infection is now a pandemic. In other words, it's affected people from all around the world. Over 3 million people are felt to be infected, and that estimate is increasing. And the caseload in the US has been really astounding. To date, I think we feel there's probably at least 1 million people with the infection across the country. And the death rate has been also significant, with over 200,000 people dying around the world, including 50,000 in the US. We know that the pandemic is reaching all across the country in different areas. There are some areas which are harder hit, as you can see from this map. The confirmed cases in the US appear to be clustered in areas where there's large population centers, especially the Northeast, including New York and New Jersey, and also Boston, where I practice. But it's also hit, of course, other parts of the country, including the West Coast in the California and Seattle, Washington areas, as well as in the South, for example, Louisiana. So this is really now a national concern and something that's affecting all of our communities. So the question is, how do we beat COVID-19 and how do we return to normal? Well, I think what's been clear from what we've seen over the last couple of months is that we need to have available tests that we can push out to our community so we actually know who has the virus and who might be potentially a concern for spreading it to their families, friends, and coworkers. I think we are clearly in a situation where there is a lack of testing across the country, so we don't have a clear handle of exactly how many people are truly infected. And recent estimates suggest that about 50% of the transmission of COVID-19 comes from people that are relatively asymptomatic or have very mild symptoms. So we need to really capture the full spectrum of symptoms that cause COVID-19. We also need to have more availability of things like personal protective equipment for our healthcare workers. Healthcare workers that are at the front lines of the pandemic are putting themselves at great personal risk of getting infection. But also, of course, their personal risk then translates into potentially risks to their friends and family who they then go home to and potentially get exposed to. So it's very important that we provide appropriate equipment in the hospitals for them to stay safe. In addition, there's been increasing discussion of trying to understand how it is that we can try to isolate cases of COVID-19 so they don't spread to our surrounding communities. And that includes discussions about contact tracing, in other words, finding people that have been in touch with folks that have had COVID-19 infections, and also isolating people when needed. And finally, the clear need is for real-time monitoring of symptoms of COVID-19, and also ultimately real-time monitoring of who develops an infection. And that's really key because at this point, we do not have a national plan for wide-scale testing. We also don't have a wide-scale plan of assessment of treatment options for people. So we need to understand better, where is the pandemic hitting us the hardest? Where are people getting sick? And how is it that we can use that information to help us understand how to get COVID-19 under control? So that's where we started with the COVID Symptom Tracker. And this is a schematic which shows you what we are essentially asking everyone to do, which is to take 1 minute of your day to help fight the outbreak in your community by reporting a little bit about your health through our mobile phone app. And this phone app is available on both the App Store and Google Play, but can be downloaded from our website, which is covid.joinzoe.com. And on there, what you can do is download the app onto your phone, and it provides a very easy interface for people to share how they're feeling. And we want people to share how they're feeling even if they feel well. So we don't want people to think they just have to join the effort if they're feeling sick or potentially might even have the infection. We really want people who are feeling well and doing well to share that information so we know that that's happening in your community, that there are people that are doing okay. But also, if you should potentially develop a symptom, we can track that in real time, which is very important information. How do we go about doing this? So as I mentioned, as a personal aside, we were first working on basically mobile apps for dietary intervention studies. And we rapidly took this platform, which was an app that people could use to track their diet, called the Predict study, and then transformed it into this C19 app, which is the COVID Symptom Tracker. And this app is what we are currently asking all of you to consider using today. What does the COVID Symptom Tracker actually do? Well, as you can see from this screenshot, it really asks very simple questions. The key question we want people to answer is, how do you feel physically right now, which you can see on the second screen. So on the second screen, you can see there are two simple choices. One is whether you feel well, and the other is if you're not feeling right. And if you feel well, you pretty much are done with reporting. There isn't much more you need to do in the app. But if you are experiencing symptoms, it takes you through several different questions, which asks you to specify what your symptoms are. Do you have a fever? Do you have a cough? Do you feel unusual fatigue? Do you have a headache? And after you finish all this information, it gives you back a report as to how people in your community are feeling. So of the people in your area, what is this current burden of symptoms? Are a lot of people around you feeling like they're also having symptoms that could be concerning for COVID-19? There is a lot of information also that's captured once someone reports their symptoms that can be used for research studies. In particular, if you are part of an ongoing research study, either part of a clinical trial at a cancer center or part of an observational cohort study, we ask for you to identify yourself as such a research participant, so we can then return this data back to your studies so they can use it to connect back with the study data you've already provided. In addition, we've asked additional questions from healthcare workers because we're very concerned again about the availability of PPE for healthcare workers and whether that's sufficient and what is the risk of exposure. In addition, we're now starting to ask questions about whether you are self-isolating, what kind of isolation tactics you've been doing, and ultimately, if you've been tested for COVID-19, because we can then use that information to understand what symptoms contribute to positive testing. This is a very powerful technique for a number of reasons. And why is this data so important and valuable? Well, we can use symptom tracking to actually identify areas around the country where there might be potential hotspots for disease. And I'll give you an example based on our collaboration with scientists in the United Kingdom, where they've deployed a similar symptom tracker and received downloads from over 2 million people. As you can see here, this map illustrates the United Kingdom. Areas where there is a darker color are areas where there have been more downloads, and so there are more users. In addition, you can also see where people are actually tracking more symptoms. As you can see here in the purple, the darker areas of purple are areas where there's a higher level of symptoms compared to areas that are lighter. And you can see that these symptoms range from fatigue, cough, diarrhea, anosmia, which is a loss of sense of smell or taste, or fever. What's really striking about this data is that you may have heard very early on that COVID-19 usually comes with a fever. But if you actually look at our symptom tracker, we actually found that fever was a relatively rare symptom. Very few people were experiencing fever. It was much more common for people to experience fatigue or cough, and those are probably earlier warning signs of COVID-19 and areas of the country that we need to be more concerned about as potentially harboring a hotspot of disease. Fever is something that comes up relatively late in the process, so it's actually not a very sensitive signal that COVID-19 might be a problem. We then can superimpose these maps on other data relative to where people are getting tested and where people are testing positive, and we've drawn really interesting correlations between these symptoms and ultimately whether people do test positive for COVID-19. Within the United States, we've done very similar maps, and you can see what we've done so far across the country with our users. You can see in this blue map where we have the most users are in dark blue, and not surprisingly, there are areas where there are large population centers, especially areas where there is a lot of concern about COVID-19 and infections. And you'll also see that we can track where in the country people are experiencing a large burden of symptoms. Of interest here is the dark purple represents about 25% of our users are actually experiencing some form of symptom, either fatigue, cough, not feeling quite right. And not surprisingly, the areas that are experiencing the most symptoms are also areas that we've heard a lot about in the news, like New York and Maine, Illinois, Georgia, et cetera. So these are all areas that potentially would be of concern. In addition, you can see that if you compare this map to the map of people who've actually undergone testing, it's not a very good match. So even the areas where there's a lot of symptoms, for example, Illinois, are not the areas where we're getting a lot of testing done. So this is actually very clear data that suggests we need to get more tests to those areas where they're developing more symptoms. This is also something that we've used to actually identify hotspots in real time. Again, this is an example in the United Kingdom where we've actually done some work with the public health authorities to show how powerful our method is. So the dark red are areas where there are potential hotspots in this area of the UK, which is Wales. And what you can see here is that what's shown here on April 1st is that there are a lot of symptoms being reported on April 1st in this area. And potentially this is also tracking well with the amount of confirmed cases. But as you start to go into later areas, like April 10, you start to actually see that symptoms are declining in this part of Wales, that it's going from dark red to light pink. And if you actually compare April 10 to the confirmed cases from the public health authorities, they start to drop after April 10. So actually this drop in symptoms actually was something that we could have predicted by looking just at symptoms as opposed to waiting for confirmed cases. In addition, you can see here that some of these areas of hotspot, for example here, were picked up earlier on April 10 and didn't actually manifest until April 15th. So we actually think that the symptom tracker gives us a 5-day lead time to know where there are potential hotspots in the country. So if we can get people in the communities here in the US to report data, we can also provide similar information about where we're potentially going to have a hotspot of COVID-19, which will allow us to be more systematic about where we send our test kits and also where we send protective equipment to our healthcare workers and where we should plan for maybe more hospital beds and ventilators to be made available. Why is this also important for people living with cancer? And I know this is something that's of particular interest to the Army of Women. We know that people who have cancer have a lot of comorbidities that also seem to be similar to risk factors for COVID-19. So we know, for example, people with COVID-19 infections and more severe outcomes tend to have issues with their lungs or their heart or their kidneys. And oftentimes that overlaps with people living with cancer. In addition, some basic science studies have shown that there are receptors for the virus that seem to be overexpressed in cancers, which suggests that maybe these cancer patients may be at higher risk of infection. And we also have heard a lot of stories in the news about people who have cancer or living with cancer having a difficulty getting in to see their doctors for appointments because a lot of clinical care has been suspended to protect people from getting COVID-19 in the hospital. Also, the shelter in place and stay-at-home orders have made it difficult for people to get out and seek medical care when they need it. This also, unfortunately, has translated into some patients not getting treatments that they ordinarily would be getting. So clearly there is going to be an impact on people with cancer that we need data on right now. In addition, we know that beyond just having complications, if they get COVID-19, people with cancer might actually be at higher risk of even getting the infection in the first place. So preliminary data from various studies suggest that COVID-19 infections are higher in people living with cancer compared to the general population. Our data from the symptom tracker suggests, in fact, that people in particular that are getting chemotherapy or immunotherapy are potentially 3- or 4-fold higher risk of getting the infection in the first place. And we also don't clearly understand whether certain types of cancer may be a stronger risk factor than others. At this point, most studies suggest that maybe blood type cancers and maybe lung cancers might be a particularly high risk group, but we need more information from people with other types of cancer, including breast cancer. In addition, again, there's a likelihood that people with cancer may actually have more severe complications. It's been shown from Chinese studies that people who have COVID-19 and cancer have a 3.5 higher risk of having a severe outcome, like ICU admission or death, and might have some more of those complicated lung problems that I mentioned earlier. In addition, those with active treatment might be at higher risk of severe events, although that's not been conclusively shown. Finally, we do want to protect our healthcare workers. This is some early data from our group showing that there is, again, a higher risk of developing COVID-19 infections among healthcare workers. And this is just data which shows in the red line healthcare workers, if you follow them over about a 1-month period, this is the actual cumulative number of people that get infected that are healthcare workers compared to those in the general community. So clearly this is a concern for our healthcare workers. And if you are a healthcare worker or work with or have family members that are, we encourage them also to get on the app to share their data so we can have this information to share with our public health authorities so we can deliver resources where they need it. So I just want to acknowledge the team of people that have put this together. I'm showing here just some people in our group. In particular, Long Nguyen is one of our data scientists who's done a lot of the work that's been put together so far. So in just a month period, we've developed data that's led to some clinical studies that are going to be released very soon. We've also stood up a consortium of studies that we're involved in across many different groups. This has been important to try to, again, bring people together across a research community to respond to COVID-19 and share this among their study participants. And I'll leave with this sort of call to action amongst the Army of Women. The question is, how is it that you can help? Well, very simply, just become a citizen scientist. If you can download the app, these are the QRS codes that you can just scan onto your phone. You can also join the app through our website. It's easily found on the App Store on Apple, not as easy to find on the Google App Store. So if you want to find us, it's probably easiest to go to the website. And again, log in how you're feeling every day. Again, we'll also send you push reminders to your phone to do that, even if you're well. And we like to take the example of social media and people who have joined our effort in their ability to push this out to their network. So if you have a friend that you can send the app to, all the better. We actually are challenging people to basically share the app with 5 people and challenge them to tell 5 people, because ultimately the more people that we get data from, the more useful our efforts will be. And even Katie Couric was able to push this out in her social media channels, which has helped a great deal. So we would challenge everybody to do the same. Again, you don't have to be feeling sick. You don't necessarily have to be living with cancer. This is basically for anyone and everyone around us. But we do want people to focus on disseminating it to high-risk groups, healthcare workers, older adults, first responders. A lot of us have smartphones, and for those of us that don't, there's also a functionality now in the smartphone to help report for other people. So you can also create a profile for a family member who's not as smartphone savvy to also basically report symptoms that they tell you. So with that, I will close and leave you again with this call to action. If each of you can just take a minute to download the app, share the information about how you're feeling on a daily basis, we'll make a lot of inroads in this COVID-19 panic and make up for a lot of lost ground in terms of our lack of information and data on how to really deal with this pandemic. And I think ultimately make a difference for all of us in our communities, as well as in particular for the Army of Women, those people that are living with cancer. Thank you very much, and I'm happy to take questions.
Thank you so much, Dr. Chan. Dr. Love, did you want to start us off with any questions?
Sure. One of the things I'm wondering about is if you have any opinions. It's not directly related to the app, but since you've been, immersed in this arena for a bit, about some of these other tests, the antibody tests, for example. It's my understanding is it's looking like some people have antibodies that never had any symptoms at all. So how does that correlate with your app?
A very good question. So that's been, I think, something that's emerging now is that, there's probably a lot of people who were exposed to COVID-19, may have had the infection, never had symptoms and cleared it. So I think we'll learn more and more in the coming months about that circumstance based on people that are undergoing antibody testing. And so we're just being able to collect data on that. We've actually started to add some functionality to the app, which will actually become live probably tomorrow, to also specify on the app if you've had an antibody test, because now we can also basically look to see how the data might differ if people have had the swab test, which is how most people get tested, and also the antibody test. So that's a very good point and very interesting for us to cover.
Yeah, that will be very interesting as we and then also what the other question that seems to have come up recently is whether you can get it a second time.
Yes.
You know,
so that's also something we're
not
collecting.
one and done as we like to think.
Yes, we're collecting that now as well. So our app has been adjusted also now to add basically the question which is asked on a daily basis, have you had a test? And it will actually specify whether it's a new test versus a test that you might have had in the past. And that way we can track people that are having multiple tests, which I think is important because, as you said, there are some people that are getting multiple tests because there's uncertainty about the diagnosis. Also, there's uncertainty about the performance of the test, but there's also now clearly circumstances where maybe people are getting the infection more than once.
Yeah, yeah. And you're not asking, because I am a loyal participant in this study, and you don't ask whether people have cancer or don't have cancer. I mean, I can see all kinds of, I see the benefit of having it be very easy and quick, and you don't really have to even hardly think to do it. But I also see the benefit of maybe having a few questions that could then take you along a further track for certain subgroups. And do you have any plans for that?
Yeah, so we do have specific questions that get asked of healthcare workers, but we also have specific questions that are asked of people if they report they're living with cancer. So we do ask, if you do report that you're living with cancer, what type of cancer you have. We're also asking if they're on a clinical study or a clinical trial because we want to know if that's impacted their participation in those studies. Ultimately, we're thinking that we're also potentially going to add to the app the ability for people to volunteer if they would like to get some additional questions through email or something else that could be used to help make the data richer. But we have been very careful to balance, of course, the need to be brief with wanting more details.
Yeah, no, I think the fact that it's so quick and easy that it keeps more people in it. And so I think that's obviously critical. But on the other hand, you've got all these people and it'd be nice to collect more information. So it's always a balance.
Right.
Other than that, I think you only ask if people have symptoms, but you don't really specify what kind of symptoms they're having too much, at least the one that I've been filling out.
Well, we do.
Is that, if I said yes, would you then, maybe it's because I haven't had any symptoms.
Yes, that's correct. So if you've been feeling well, it's basically a 10-second response. I feel normal. Okay. If, however, you are experiencing a symptom, then you do.
Then you start asking. I got it. I got it. Okay, I've got it. Good. Okay. Well, Cheryl, do you want to go on? Any questions? It looks like we have a lot of questions from the audience, so maybe we should get on with that.
Hi. Yes, thank you, Dr. Love. We do have a number of audience questions for you, Dr. Chan. And a lot of participants are asking for you to speak more into privacy, security, kind of where is this data going, and where can participants view some of this ongoing data that you're collecting?
Great. Yeah, that's a terrific question. So we are entirely aware of people's concerns regarding, their privacy. And as a physician, as someone who, cares for patients and does a lot of studies, I think that privacy of our participants and our study volunteers is really our highest priority. So we don't ask anything on the app that we feel is something that could be misused. All of the information on the app is entirely voluntary. So if there's any questions you do not feel comfortable responding to or asking, you don't have to do so. We do have a very clear set of guidelines in the consent process, which is a consent that's been approved by our hospital's institutional review board for the guarding of your information, because obviously, you know, there is health information that's being shared with us. So we do have very clear guidelines in those privacy statements and in that institutional review board consent form that outlines clearly the people that get on the app can be assured that their data will be protected and not shared with any third party, i.e. anybody from the government, any insurance agencies, anything like that. We have a commitment also, if you are a study participant, to return data if you wish back to your parent study. So when I say parent study, there are a lot of people on the app that are members of other studies. For example, we have a large number of women on the Nurses' Health Study that are enrolled in the app, and they actually do want to make sure that the information that they report on the app gets sent back to the Nurses' Health Study investigators so that they can link the data they've been offering us for the last several decades on their diet and lifestyle, because then we can really start to ask, you know, questions about whether diet and lifestyle have an impact on getting infected or outcomes. So if you are a study participant, you are encouraged to provide an email address, for example, that you link up with your parent study on so we can connect that data back. But if you're not a study participant and you don't want to provide that information, you don't need to. Obviously, we just want people to report their symptoms and they can do so anonymously. The last thing that I think is really important for people to know is that this is not a tracking app. And that's been something that I think a lot of people have been concerned about, because there are also parallel efforts from, for example, Apple and Google to put a tracking function in people's phones so that if you do potentially come into contact with someone with COVID-19, you would get notified. And if you yourself end up with COVID-19, people that have been around your phone would be notified. That's a very different effort and something that we are not actually a part of at all. And certainly there are reasons why people might want to be a part of that effort and why some people might not want to be. So, you know, that's certainly something that you can do in addition to our app. That would be a separate effort. But we're different from those sort of contact tracing apps.
Great, thank you, Dr. Chan. So I have another question here. And this is about reporting symptoms on other people in the family.
Mm-hmm.
This participant indicated, I'm not reporting on anyone else because it was not clear to me who I needed to report on. Should we be reporting on people who live with us?
You can do that. You can report on anybody. You can report on, you know, a relative, a friend, someone who, you know, obviously, you know, if someone is, you don't want to report for somebody who's already reporting on the app, because we want obviously independent reports from people. But if, for example, you live with somebody who, you know, doesn't really have the time to report or isn't able to really get on their phone and know how to get it to work, you can do that on their behalf. And it could be someone you live with, but it doesn't have to be. It also could be, for example, if you have a relative that you're on the phone with, and you're checking in with, and you know they may be someone who isn't using apps or smartphones, you could ask how they're doing and then report on their behalf. So it's designed to be really functional for any sort of circumstance.
Great, thank you. And kind of along the accessibility questions, is there a desktop version of this app? Can this be used on the desktop, or do we need a mobile phone?
At this point, we don't have a desktop or computer version. And that's something that we hope to do sometime soon, largely because this effort has been sort of a grassroots effort. So the company that's been helping us with the engineering of the app is doing this with entirely philanthropic funds. And so their engineers have really put in time and effort and labor to do this for an app on the phone. Once we, I think, are able to get a little more breathing room in terms of time and resources, we will ultimately hope to get something on the computer. One effort that was partially the reason why we introduced this ability to report for somebody else was to help to address that potential issue for people that don't use smartphones. But ultimately, we do hope to get something available on the computer as well, and also ultimately hope to find other communities to use it in around the world. So we've just, for example, launched this app in Sweden as well as the United Kingdom, and we're certainly working to get it in other countries as well, including Australia, Canada, and other places.
Great, thank you. So we're getting very similar questions, and I think you kind of touched on this, but I'm going to ask again because I think a number of people want some clarity. So the app asks if there has been COVID-19 test completed. Does that include the antibody test as well as the nasal swab, or just the latter?
So at this point, what we had intended to collect was the swab, because that was what people were getting. But now that the antibody tests are being used more broadly, we are now asking for people to distinguish between the two. So the actual app that's going to be available, I think starting tomorrow, will actually have that functionality to specify what kind of test you've had if you were told you tested positive. And it will ask, was it a blood test or a swab test? And the blood test obviously is the antibody test. And also, if you've had the antibody test, we want to know whether it was some, most people are told if their antibody test suggests they've been infected recently or if they've been infected in the past. So we're going to try to ask people to specify that as well. So there will be that ability to report more specifically what kind of test you received, which is one of the nice aspects of using this type of app, is that we can adjust the questions in real time, which is very important because as the pandemic has unfolded, we know now that there are new things that we should be collecting based on how people are experiencing symptoms or how people are getting tested.
So there's another question about the numbers. So do they represent that day, people indicating showing symptoms, or is it kind of cumulative over the entire?
It's for that day. It's for that day, yes. So you can actually, it's kind of neat because you can then kind of see within your own community how things are changing. And that's ultimately one of the things that we would like to do also, is if you check out our website where it's on the screen there, we are now providing maps again of the United States where people are reporting and where people are feeling symptoms. We're going to update those maps periodically. And then we're also going to introduce maps that are actually more kind of live action, that kind of can show how things are changing dynamically over time. So I think that'll be very interesting. I would add that the website also has a lot of additional reports of data that we're coming up with that would be of interest for people to read about. So if you're interested in finding out the things that we're learning from the app, that gets updated as well. It also gets updated with sort of media reports and sort of what people are reporting on from the app. And if you have any technical problems, that would be a place to go to. We have a technical team that can address your download problems, download questions, anything that happens that challenges you to report your symptoms because of things freezing, what have you. You can contact people through that website and also through my team at MGH. So we want obviously to be as responsive as possible so people don't have any technical hiccups.
Great. We have another kind of security-related question. What aspects of data, name, email address, etc., is shared across similar studies where they're asking for individuals' help?
So the data on name, email address, phone number, that's not shared unless you want it to be shared with a study you're already participating in. So if, for example, you're a member of the Nurses' Health Study or a member of a clinical trial and you want those investigators to have that information, and you consented to that, we will share that information back to them so that linkage can be made. If you otherwise, don't intend for that to be the case and you're not a part of a study, then we don't share that information with anyone. we use information about, for example, zip code to give you that real-time information about how people are feeling in your communities. But we don't give that information about your name or email or anything to anybody.
Okay, great. And then one last question. So your data indicates that that fever might be actually a later indicator of illness. Would you recommend that maybe fever is not kind of touted as one of the first early indicators based on the data that you see here?
Yeah, I think that's a very good point, and that's something that we've learned through this work, is that fever is a late indicator. So what we want people to be aware of is that the symptoms of COVID-19 vary a lot. Some people, again, have very mild symptoms. Some people get very, very sick. And what our data suggests, which has been supported by other studies, is that some of the earliest signs are signs that people maybe didn't really think of as being COVID-19 related. So a good point, a good example of that is the loss of taste or smell. That was not something that was appreciated early on in the pandemic and was not reported from the experience in China. But it started to be reported anecdotally in some of the studies that were coming out of Europe. When we launched the app in the UK and the US in March, early April, we found that loss of taste or smell was actually very, very common. Probably about 60% of people that ultimately tested positive actually experienced that as their first symptom. And so that's been really important, and that's led to our ability to use symptoms collected on the app to develop a predictive model of where we expect there to be more cases of COVID-19 that allow us to do that without having to test everybody in that population. And again, gives us an earlier warning sign because it seems to be an earlier sign of the disease than fever, where it's almost too late and those people are already showing up to the hospital. In addition, as you may have seen, the CDC recently released new guidelines about what they consider COVID-19 symptoms, and now loss of taste and smell are on those guidelines. So it's a clear example of why we need to collect data right now, analyze it, feed it back, because it does make a difference to people's experience and interactions with their healthcare providers. So now, from here on out, we're hoping that people will pick up on the fact that they should be asking their patients, have you lost your sense of taste or smell? Do you find there's a difference in how your food tastes? Things like that, which can be, again, earlier signs that we need to pick up on because it can be a warning sign of an infection.
Great, thank you. And now I think we're running short on time. Dr. Love, did you have any other final thoughts to add?
Well, I think this has been really terrific, and it shows you how with not even having to spend a lot of time and a lot of questions, how much information you can get and why it's so important that you jumped right on this and started right away collecting it. So I think you get a lot of credit for that, and I thank everybody who's participating. I know I participate every morning, and I hope you are too. And if you enjoyed this, and if you want to support other things that we do with the foundation, we have some things we just jump on when we get the opportunity, and new ideas that come up that take a little more time. But we would love to have you support us through our virtual Walk with Love. So for years we've been doing this Walk with Love, which is a fundraiser, and obviously we can't do that this year. So it's going to be virtual, and you don't have to walk. You can ride, you can crawl, you can skip, you can swim, you can bike, you can do whatever you want. And go to walkwithlove.org. All the funds go directly to research. And we have some, really interesting stuff working on figuring out the breast and the normal breast. And I think that I think is going to be really exciting. And so I've never been more excited about where all the research is going. And I'm very excited to have all of the the collaborations that we have to do it, like this great collaboration with Dr. Chan. So thank you all for joining us, and this concludes today's webinar.